WNN.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Welcome to the Heal Yourself Show with Doctors Jonathan Chung and Greg Jean-Pierre of Keystone Chiropractic in Wellington and the Upper Cervical Institute of Florida. Dr. Chung and Dr. Jean-Pierre are chiropractors with a focus on correction of the upper cervical spine. Together they have worked with some of the leading doctors and health experts in the country and have helped thousands of patients regain their health from a variety of chronic health problems related to the structural alignment of the head and neck. Dr. Chung and Dr. Jean-Pierre have authored and published in peer-reviewed scientific journals. They've also been featured speakers around the country on topics ranging from head injury, chronic pain, spinal health, and fitness. Their goal is to teach you how to unlock the doctor within and heal yourself. Join them today as they share their passion for serving families and helping people who could not get better through traditional and alternative means. Call the Heal Yourself Show at 888-565-1470.
Good afternoon and welcome to another episode of Heal Yourself Radio broadcast. My name is Dr. Gregory Jean-Pierre and alongside me is Dr. Jonathan Chung. And today we have a great show for you. We're going to talk about women's health as pertain to osteoporosis, menopause, and thyroid. But just like last time, we are doing it live on the internet, and we're going to have some slides there for you. So what we're going to do, we're going to take a quick commercial break to give you some time to go and log in the internet. You can see us on two different sites, www.nnradio.com or the Heal Yourself Radio website, which is healyourselfradio.com. www.nnradio.com or healyourselfradio.com. And as always, this is a live show, so you're more than welcome to call and ask any question at 1-888-565-1470. 1-888-565-1470. We have a great show in store for you, so go log in and we'll be right back.
When was the last time you had your atlas checked? When your head and neck shift out of place, it can actually affect your whole body. Do you suffer from migraines, TMJ, dizziness, or chronic back and neck pain? If so, you may have an atlas problem, and you need a NUCA chiropractor. NUCA allows for a gentle and precise correction of your spine without any popping, twisting, or cracking associated with conventional manipulations. Call Keystone Chiropractic at 561-247-0044 and schedule a free consultation. Dr. Chung is one of approximately 300 doctors in the world trained in the NUCA protocol of spinal correction. Stop suffering. When your doctors can't determine the problem, you need to contact Keystone Chiropractic. We won't ask you to believe in chiropractic or commit to a lifetime of treatment. What we will do is show you what normal is, and we'll tell you how to get there again. We'll show you using precision technology that your spine has changed for the better, even after one correction. Then we'll show you the path for keeping it that way. If you are tired of constantly patching the problem and you're looking for a long-term solution that you can both feel and see for yourself, then a NUCA office is the right place for you. Once the foundation has been fixed, then we'll teach you how to keep it that way through customized recommendations designed for your spine so that the problem doesn't come back. What do you have to lose? Call today to schedule your complimentary consultation. If you call during the hour, we'll give you a $100 gift certificate to use towards your first visit. No questions asked. No commitments, just a conversation to see if we can help. Two convenient locations in Boca Raton and West Palm Beach. Call Keystone Chiropractic today and end your days of suffering with chronic pain. Call us at 561-247-0044. Check out the website, healyourselfradio.com. That's healyourselfradio.com.
Are you searching for answers to your health problems? Are you looking for an alternative to harmful drugs and dangerous surgery? Have you tried everything else and figured this is just something you're going to have to live with for the rest of your life? At Upper Cervical Institute of Florida, we provide you with a safe, effective, and natural approach to restoring your health and regaining your life. Dr. Jean-Pierre will find the cause instead of masking the symptoms. Dr. Jean-Pierre utilizes the most specific techniques in detecting and correcting the vertebral subluxation. At Upper Cervical Institute of Florida, we pride ourselves in providing you with the highest standards of healthcare for you and your entire family. The procedure is gentle, effective, and affordable for everyone. Call now to schedule your free consultation. 561-409-3594. That's 561-409-6594. Or visit our website at www.uci-fl.com.
Hello again, everyone. And again, the purpose of the show of Heal Yourself Radio broadcast is really to teach you how to heal yourself, how to get in touch with the doctor within you. We believe that the body is a self-healing, self-regulating, self-adapting organism, and it really doesn't need any help from the outside. It just needs to be free of interference. So as NUCA doctors, one of our main goals is not only to educate the population, but to also teach them about how to release interference, specifically at the top of the brainstem, to allow the body to gently heal itself. So today's topic, we're going to talk about some of the things that happen mostly in women, some of the most common symptoms and diseases and side effects and stuff like that we see in our office.
And one of the interesting things about women's health is that a lot of people associate what we do with, low back pain, and they think like, oh, we probably just get a bunch of, guys that work in construction yards and things like that, and those are the people that tend to see chiropractors, when the truth of the matter is about 60% of our patient base are actually women. So women of all ages coming in with different conditions like migraines, of course neck pain, and of course, as women start to go into their later years or golden years, some issues start to come up as far as what they should do about problems like menopause. People are afraid of osteoporosis. And of course, it feels like every person or every woman in the world has a thyroid condition these days. So we're going to be talking about, what these conditions really are and what can possibly be done about them, if there's anything that can be done about them outside of the medical model.
Yeah, and again, just like you said, majority of our patient, or majority of the patient that I see in the office are women, because guys tend to think that, okay, I have this pain, I can, it'll go away by itself, or it's not that important, and they usually come in until it's too late. Just to give you an example of my wife, when I started adjusting her, I just started adjusting her because she had back pain, and little slowly the back pain started going away. But one of the things that she noticed after she started getting adjusted, the month after her first adjustment, she usually have major issues when it comes to menstrual pain. The first day of her cycle, she's in terrible pain. She would have to call out of work. She had headaches. She was vomiting. She was just miserable. After the adjustment, the back pain started going away, but she noticed that she didn't even have the pain anymore. I remember the first time that she got a period after that, somebody told her that she had a spot on her pants, and that's how she knew that she had a period. There was no pain whatsoever. So again, the adjustment that we do in the office is not about pain, symptoms, and disease that you said. It's really to allow your body chemistry and your body to work properly in cases where everything else starts working properly.
And I think that's a great point that you just brought up, Dr. Greg, is the fact that, we're talking about body chemistry here. So chiropractic is less so about bones and things like that. It's really about the chemistry of the body and how the nervous system interacts with all that chemistry. So we think about our bodies as these bags of, millions of chemicals, and each chemical has to get to the right place at the right time in order to have, the right outcome. And when we think about, thyroid and the hormones that get released from it, just a tiny little bit of thyroid hormone can determine whether you have fast metabolism or slow metabolism. And a lot of people are, they start putting on weight, they start putting on pounds, they don't know why, they're changing their diets, and they're asking, why is this problem coming up? And a lot of it goes back to thyroid issues. And I remember this one case where I was taking care of a patient about 2 or 3 years ago, and the reason she had come see me was actually because she had hip pain and neck pain after a car accident. And even though the hip pain and neck pain actually went away really quickly, she actually started to notice that, she was having a lot less hot flashes as she would normally have, and she actually started to lose weight a little bit easier. And she would come up to me and just thinking like, does this have any impact on my thyroid function? I'm like, I'm not promising anything, but if your spine and nervous system are working better and the brain's talking to the body and it's directing the hormones where they're supposed to go more effectively, yeah, sure, of course it could affect the thyroid. Now, as she continued to lose weight, she was like promoting all these people in their practice, like, Dr. Chung helped me lose weight. I was like, I am not a weight loss clinic. But, if we get your body working the way that it was designed to, then of course, you could get those side benefits, like better thyroid function, just better raw body function.
Yeah, and that's the thing. A lot of time when we think about some of these things like menopause and thyroid conditions, specifically menopause, those are not sickness or disease. Those are normal body function, and it creates inflammation in the body. But it's when the body is not able to regulate as it should, typically because of an interference, so the chemistry not what it should. So by adjusting or by removing the interference, the body is able to regulate itself. So a lot of time what we think of as being a problem is just the body's normal ability to do what it's supposed to do. So we always want to be mindful of not, and just like we talked about last week, you got to start asking the right question. It's never how I get rid of the symptoms or the pain of the disease, but rather than why do I have it in the first place? Because once you understand the biomechanics, the physics, the chemistry behind what's going on, typically it's easy to fix because that's the body's natural ability and the body's healing itself.
Yeah, and I think one of the things that we're going to be talking about today as we go into our first slide is when we're thinking about some of these women's health issues, when we talk about menopause, when we talk about thyroid problems, let's not think about these as sicknesses. Let's think about this as a change in a woman's body chemistry instead. So, just the natural cycles of life are changing the way that chemicals are dispersed in our body. So we look at menopause, we think of menopause as, a natural transition in a person's life. It's not a pathology where a lot of, people are trying to, put disease names onto normal processes that happen in the body. And conventional treatments for menopause, a lot of them can, quite frankly, have come with a lot of side effects, and a lot of people don't know that natural alternatives are available for it.
Right, and then that's the thing. Menopause is not a sickness or disease. It's the body's natural process. It happens when the ovaries stop releasing eggs or the ova. And the decade before, when we talk about the perimenopausal term, it's just hormonal change that can have physical, mental, emotional, and social impacts on a woman's health and well-being. Yes, it's not pleasant, but those are things that the body needs to go through in order to go through those changes in order for your body to respond properly.
And one of the things that I want to make it a point of is that when we think about natural transitions for the body, a lot of people want to really hammer this label. It's the same thing that's really happening for depression. Like when people have this tragic moment in their life and they get sad, people are getting put on antidepressants. And one of the main problems is that something like an antidepressant will change your body's chemistry just as much as the natural hormones in your body too, which creates problems in your brain chemistry as well. So don't overreact about natural occurrences in our lives. People often say that they treat pregnancy as a disease instead of this thing that happens when human beings just live normally.
Yeah, and again, just one of the slides that's up right now is talking about balance, and really that's what we do as NUCA doctors. It's all about balancing out the body, removing the interference to getting it back to its proper balance so the body can function at optimal level. So when functioning optimally, our bodies produce all the hormones and all the chemicals. We have the biggest pharmacy within us, and the brain is able to produce every kind of drug that you can possibly think of. So the modern medicine is trying to duplicate some of the things that the body is able to do naturally, but the body is able to release the right amount at the right time and be able to direct that to the specific location, whereas modern medicine has not been able to do that. You take an aspirin for a headache, the aspirin doesn't only go to your head to cure the headache, but it also goes to your entire body, which is why the term side effect is something that we use these days.
And I like this slide because it talks about once your ovaries stop ejecting eggs, and it talks about how the body begins to normalize, other organs pick up the slack and compensate for decreased ovary production.
Right.
And your body is so good at compensating for what's happening inside of it. Your brain actually has this concept called plasticity, where if parts of the brain actually died, and other parts of the brain will actually pick up for the functions that piece of brain that was missing used to do. And it's just really cool to see how the body compensates for what's going on, and that it's always doing what it's in the best interest of the body to heal.
Yeah, and again, it's a natural process. So some of the symptoms that some people might be experiencing: heavy menstrual bleeding, bloating, or irregular menstrual flow, hot flashes and power surges, dryness and bladder changes, emotional changes. All these things are part of the process. And if you take medication to decrease that process, as if you're treating a disease or symptoms, then the body's going to create other side effects and other things, and that's why a lot of people end up being depressed. And there's a lot of side effect that comes out when you stop the body's natural process.
And some of the things that also happen is, while you're going through this transition phase, there is an increased risk for osteoporosis, and there's a slight spike in a risk for, heart disease and some other problems, because the way that estrogen gets ejected actually affects, things like your blood cholesterol, and that it changes your blood chemistry as well. So these are things, of course, you always want to monitor, but they're not necessarily things that need and require immediate treatment. So, for example, osteoporosis is something that you could start from your 20s and 30s, starting to prevent, not only just by overloading yourself with calcium, but really putting exercise and forcing your bones to make more bone and become harder, so it has less chances of degrading over time as you get older.
Yeah, and when you talk osteoporosis, then there's all these medication, all these things on the market for that. But one of the things I recommend my patients with osteoporosis and the best thing you can do is motion. Putting some pressure on those bones to allow the body, because again, whenever you do something like you put pressure, the body's going to respond. So even though moving hurts, that's the best thing you can do for your body, because life is motion. Once you stop moving, you're dying. So you want to move, you want to actually do something to prevent osteoporosis, and exercise is the best thing. So again, I wanted to print out this on this slide. It clearly says menopause is not a disease, although medicine continues to treat it as if it is. Then there's tons of drugs and hormone replacement therapy, and there's tons of controversy happening these days with some of these drugs. But you got to keep in mind, your body has to go through this process. It's the process of releasing things that your body no longer needs and no longer has use for, in order for the body to function optimally.
And one of the most common treatments for symptoms of menopause is to go through hormone replacement therapy. And there's a lot of controversy about it, just because a lot of people that went through the initial phases of hormone replacement therapy had a tremendous amount of side effects.
Right.
So it's definitely one of the things that you want to be wary of when you're manipulating the hormones of your body. Okay. The hormones of the body are powerful chemicals, and it only takes a tiny little bit to really change how your body functions overall. So just for example, we're looking at a hormone called Premarin, and side effects of Premarin include cancer of the uterus, cancer of the breast, gallbladder disease, abnormal blood clotting, and you could really see the list on that chart over there.
Yeah, and that's only half the list. We didn't put that on there, but I'm looking at it here. Besides pancreatitis, you have nausea and vomiting, skin disturbance, loss of hair on scalp, increased body hair, venous and pulmonary embolism, eye problems, central nervous system dysfunction, headaches, migraine, dizziness, mental. I mean, the list goes on, and I couldn't even read all that stuff. But again, because you're not treating, you're treating something that's natural, the body's going to actually do something, which is these side effects. And that reminds me of another drug that's not used for that, but that's used for smoking. I encourage you, if you're on the internet later, go on YouTube and look at Chantix commercial. It's a drug that stopped smoking, but yet after that, it's 2 minutes worth of side effects. Again, side effects are when the body's not working properly or the drug is not doing what it's supposed to do, because the body was already doing that. And just like it's on the side, even if the hormone replacement therapy worked, is it worth it with all the symptoms that can be happening? Because a lot of times the symptoms and the way that you feel is not a cause of menopause, but it's a cause of the drugs and the medication that you take in.
And I just want to touch on the fact that taking hormone replacement therapy comes with this increased risk of cancer, and a lot of the big reason is because when you're artificially putting hormones into the body, you're stimulating cell growth. And when you artificially stimulate cell growth, then that cell growth can actually become unchecked and just grow out of control. And when it grows out of control, then that's when we call things cancer.
Right.
Now, the important thing to remember is that the brain is in control of every single endocrine function in your body. So the way that your body is functioning right now without our hormones being put into it is the way that it knows how to best take care of itself. When we start, pushing your body past its limits and ignoring why the brain has the hormone levels that they currently are, then it gives a pretty good explanation for why all these side effects start to happen.
Right, and trying to get to the next slide. And folks, we're going quickly through these things, so if you guys want a copy of this, we're going to make this available for you at no charge. Just give us a call and we'll send this to you. But one of the slides, and it clearly goes to what you were talking about, one of the estrogen replacement therapy, it has been added to the official government list of cancer-causing agent. The report is part of the National Toxicology Program review of carcinogens. So again, some of the things that we're taking as far as to cure or to combat the effect of menopause, it's actually this very same thing that is causing cancer and other things in the body, because we're going against the body's natural ability to heal itself. Well, the premise of the show is that the body is a self-healing, self-regulating, self-adapting mechanism. It doesn't need anything from the outside world. It really needs to be interference-free. So by adding these agents in the body to combat the body's natural ability to heal itself, it causes different things such as cancer.
So I think one of the big things that, the distinctions we want to make is that there's nothing that we're going to tell you today that is going to, get rid of the menopause symptoms and going through, try to replace your hormones. One of the things that we advocate really is to take the steps to go through this process gracefully. Right. And that's really what you could ask of your body, is that you go through this process gracefully, because if it's going to happen, then you might as well do it in a way where, your life is still pretty normal. And a lot of that really starts not by trying to treat the symptoms when they occur, but it means going backwards to, the people that are in their 20s, 30s, and 40s well before menopause, and making sure that you're eating this really clean, healthy diet, and that your body is well prepared to, have the biochemicals from your food to produce the right hormones and get them released at the right time, because we know that things like being overweight and drinking too much soda and some of these other factors affect your body's ability to promote emit hormones, and that can also have long-lasting effects down the line. And it's the same thing with getting exercise too.
Yeah, and while you're talking about that, it just reminds me, in South Florida here, we get a lot of hurricanes. So when the hurricane comes in, we get all these people, they go into Home Depot and buying all these things. So I like to think of menopause as a hurricane. I mean, this is the men talking, obviously. So all these things going to happen throughout your body, all these changes going to happen. You don't want to start getting prepared for that when it's going to happen. It's like, okay, now I'm at the age where I can start feeling symptoms. That's when it's going to happen. Generally, women with good bone density prior to the onset of menopause are less likely to suffer from osteoporosis. So just like we mentioned, some of the things you want to get prepared now. You want to start exercising, eating properly, and doing the things necessary to allow your body to be able to go through that change gracefully and not deteriorate, because this is a major change, menopause. So if your body wasn't prepared for it, that's when your body starts deteriorating, and you start getting all these symptoms and problem. Because again, this is a natural process. You all going to go through it. So you want to make sure that early on you prepare for that.
Absolutely. And in our next segment after our commercial break, we're actually going to be talking about thyroid function, which I know is a big topic that a lot of women have questions and concerns about. So we'll be addressing a little bit of that after this next segment and after this commercial break. And for our listeners that are just tuning in, make sure you check into wwnnradio.com and check out the slides that we have for you. The internet show is streaming, so check it out, and we'll see you after this commercial break.
Are you searching for answers to your health problems? Are you looking for an alternative to harmful drugs and dangerous surgery? Have you tried everything else and figured this is just something you're going to have to live with for the rest of your life? At Upper Cervical Institute of Florida, we provide you with a safe, effective, and natural approach to restoring your health and regaining your life. Dr. Jean Pierre will find the cause instead of masking the symptoms. Dr. Jean Pierre utilizes the most specific techniques in detecting and correcting the vertebral subluxation. At Upper Cervical Institute of Florida, we pride ourselves in providing you with the highest standards of healthcare for you and your entire family. The procedure is gentle, effective, and affordable for everyone. Call now to schedule your free consultation. 561-409-3594. That's 561-409-6594. Or visit our website at www.uci-fl.com.
When was the last time you had your atlas checked? When your head and neck shift out of place, it can actually affect your whole body. Do you suffer from migraines, TMJ, dizziness, or chronic back and neck pain? If so, you may have an atlas problem, and you need a NUCA chiropractor. NUCA allows for a gentle and precise correction of your spine without any popping, twisting, or cracking associated with conventional manipulations. Call Keystone Chiropractic at 561-247-0044 and schedule a free consultation. Dr. Chung is one of approximately 300 doctors in the world trained in the NUCA protocol of spinal correction. Stop suffering. When your doctors can't determine the problem, you need to contact Keystone Chiropractic. We won't ask you to believe in chiropractic or commit to a lifetime of treatment. What we will do is show you what normal is, and we'll tell you how to get there again. We'll show you using precision technology that your spine has changed for the better, even after one correction. Then we'll show you the path for keeping it that way. If you are tired of constantly patching the problem and you're looking for a long-term solution that you can both feel and see for yourself, then a NUCA office is the right place for you. Once the foundation has been fixed, then we'll teach you how to keep it that way through customized recommendations designed for your spine so that the problem doesn't come back. What do you have to lose? Call today to schedule your complimentary consultation. If you call during the hour, we'll give you a $100 gift certificate to use towards your first visit. No questions asked. No commitments, just a conversation to see if we can help. 2 convenient locations in Boca Raton and West Palm Beach. Call Keystone Chiropractic today and end your days of suffering with chronic pain. Call us at 561-247-0044. Check out the website, healyourselfradio.com. That's healyourselfradio.com.
And we're back. This is Dr. Jonathan Chung from Keystone Chiropractic, as always with my partner in crime, Dr. Gregory Jean-Pierre. And you're listening to the Heal Yourself radio show. And for our listeners that are just joining us, make sure you get on the web and check out www.nnradio.com for the stream. We got the PowerPoint slides going on here today, and we're talking about women's health. Also, if you have any questions or comments for us, then definitely give us a call at 1-888-565-1470. That's 1-888-565-1470. So, Dr. Greg, we were talking about, right before we ended the show, we were talking about thyroid problems. And I don't know about you, but it feels like almost every single woman that walks into the office these days has been diagnosed with some sort of thyroid problem. But I don't think a lot of people are completely sure what that entails. So we're going to talk a little bit about that now. So what is your thyroid? So your thyroid is this gland that's in the front of your neck. And the important thing about the thyroid is that it has a huge impact on the body's metabolism.
Right.
So when people usually have a thyroid problem, then you have to be very clear on what's going on, because you could have too much thyroid function, and those are people that have very difficult time putting on weight. Oftentimes they feel like they're a little bit out of control, and they feel like they're getting hot flashes, and that their metabolism just goes crazy. And there's too little thyroid. And those are the people that will tend to have problems actually losing weight, and they come with all these other signs that are indicating of metabolic disease as well. So when we look at our next slide, we're talking about what does the thyroid affect. So it affects your carbohydrate metabolism, which of course is huge in how a person can maintain weight. It affects fat metabolism. It affects your vitamins, your basal metabolic rate, which just means your ability to control your body temperature, and it also regulates your heart rate, blood pressure, and a lot of other systems in the body.
Yeah. And again, when we talk about, it seems like a lot of our patient has thyroid because when you come in the office, we do take some specific x-rays of the upper cervical spine to see what's going on with the atlas. And a lot of time people are worried about it because like, wait, but I have a thyroid condition. And because the thyroid affects so many things, it almost seems like it's a diagnosis of, it's like, I don't know what else is going on with you. Because just like you said, not only the thyroid can affect all these things, but on this side here, you can see it also affects your respiration, GI tract, central nervous system, function of the muscles, sleep, other endocrine. Because when you come with all these things, it's easy to say you have a thyroid problem because the thyroid controls so much in your body chemistry that it's important to recognize what's going on with you and what are some of the things that we can do to actually help with that.
And of course, this isn't to say that every woman's making it up, because there are very legitimate thyroid conditions. For example, Graves' disease and Hashimoto's disease are basically autoimmune diseases where your immune system is attacking, parts of your thyroid and preventing it from working properly.
Right.
Then, those are very easily diagnosable diseases that can have a dramatic impact on a woman's life and health overall. But there's also a lot of people that just go to the doctor's office and they go get a blood test, and it's like, oh, your thyroid hormones are a little high, or your thyroid hormones are a little too low. And from a blood test from that instant in time, they're making these big assumptions about what their health is actually what's going on in their health. So it's a little bit of a interesting time because a lot of people want to jump to that thyroid diagnosis and have a reason for why they're struggling with some of their health problems. But a lot of these are actually, just like we talked about with menopause, it's this problem of body chemistry.
Yeah, and again, if you look at the next slide, even though we're talking about thyroid, also talking about osteoporosis. And I don't want to go through all that stuff, the family histories, because more often than not, these things, and I get people all the time that says, well, I have this problem because it's my family history. And I always want to be careful when people say that. Yes, part of it can be genetics, but a lot of times some of these things that people are experiencing have nothing to do with family history, but rather than the lifestyle that's been passed on from grandparents to child and so on and so forth. I remember a quote that says, it's not that diabetes runs in your family, it's that no one in your family runs. Okay, so if you've been thought to cook a certain way since you were from your grandma, then your mom cooked the same way, so it's the same familial link as far as food and exercise and lifestyle that's causing what we call a family history. All right, so all these things can increase osteoporosis, but just if you look at the next slide, it talks about some of the things that can decrease it. Being active, and again, just like my favorite thing to say is life is motion. If you're moving, your body's going to work properly. If you're not, then you're going towards death. So if you maintain a healthy diet, and I can't express that enough, what you put in your body is the body's fuel. You can't expect to be function at 100% and your body to be able to heal itself if you're putting all the junk food, all the alcohol and smoke and all that stuff. So again, instead of thinking of family history, think about things that you can do to change your lifestyle, and those things won't be an issue anymore.
And that's one of the other things that we're talking about when it comes to osteoporosis is that, in chiropractic there's a well-known rule called Wolff's Law.
Mm-hmm.
And what that basically means is the more stress that you place on bone, the more that the body will put calcium into the bones to resist those stresses. And Wolff's Law applies in preventing of osteoporosis because the more stress that you put onto the bones of your limbs, your spine, your extremities, then it's going to build up more bone to make it stronger so it can resist those stresses. So that's why it's so important that you exercise now when you're at a younger age, and you can build up that calcium into your bones so you have much more calcium to get rid of as you get older.
And one of the things that we're going to talk about is the misconception about milk and all the other things. But first, I believe that we do have a caller on the line, and so let's get to her. Diane, how are you?
Yes. Hi.
Hi, how are you? On the air?
Hi, I'm good, thank you. I really appreciate the topics you guys are hitting on today. I can relate to the Premarin issue because I went through early menopause, being fixed at an early age. In my 30s, I had a complete hysterectomy. So I did go through the menopause, the hot flashes and everything, and they, of course, put you right on Premarin. And I thought I had to be on it. Well, since I've been off and doing the NUCA chiropractic care, I haven't had any problems with menopause whatsoever.
All right, that's pretty outstanding, Diane. Can you share a little bit about that experience?
Well, the experience was awesome. I've been to other doctors and specialists, but this is the first time I've gone into a doctor's office where I didn't feel any of the movement that was being done to my body, even though after the adjustment, I felt 100 times better. I mean, it was like instant relief without any preload to pain.
So Diane, did you go in there specifically for the menopause issues or other things?
No, I went in because I have a whole laundry list of things, from osteoporosis to fibromyalgia to scleroderma to Barrett's esophagus, and everything has been put into place over time, and I believe it's because of the NUCA adjustment.
Yeah.
That's pretty outstanding. Thanks for sharing your story, Diane.
Oh, you're welcome. Keep up the good work on your show.
Awesome. Thank you, Diane. We appreciate the call. And just like Diane mentioned, you know, typically a lot of people come in for the typical things, the chiropractor or to our office. They talk about, you know, have the back pain, the osteoporosis. But you know what? We're not fixing those things. When people come into my office, it may almost sound mean when I say it. I could care less about the symptoms and disease. What I care about is what we talked about last week, is the subluxation of the atlas. Because when that is out of position, it literally interferes with every single part of your body, every body chemistry, every mental impulses, everything's interfered with. So by removing that interference, the body is able to not only take care of the pain and symptom that brought you in, but really set the body back into its normal, natural, stable position to allow the body to heal itself.
Yeah, that was a great call. I definitely appreciate, you know, anyone that's throwing a testimonial out there for, you know, the type of work that we do, because it's all about getting the word out. Now, we're about to bust a pretty big myth here, and we're talking about, you know, we talk about osteoporosis. We often talk about calcium, and when people talk about calcium, then the one thing that people want to jump to is like, oh, we need to get more milk inside of us. And I think you have a couple of words about that, don't you, Dr. Greg?
Yeah, and again, if you look at the research, I mean, we're the only species that actually drink milk after babies, you know, and even the cows don't drink their own milk. I mean, you see baby cows drink it, but cows don't drink their own milk. So milk is really not something that the body can even digest. You know, this was the commercial that does milk does a body good. It builds strong bones, and you know, but yet there's no scientific evidence whatsoever that supports that. Americans have among the highest osteoporosis rate, while our dairy intake is almost among the highest. So what does that tell you? You can't even digest the milk because of, I believe, something called casein. You can't digest it, so you can't really get anything as far as calcium when it comes to milk.
And there are much better sources of calcium than milk. So for example, you know, eating green leafy vegetables like kale and broccoli are incredibly abundant and effective sources of calcium in order to get that into your bones much better. And then I've also found that a big problem with osteoporosis is less so they lack calcium, because when people get calcium blood tests, they have plenty of calcium in their blood. It's not getting to the bones. And the other thing that you need in order to make healthy bone is you need magnesium, you need sulfate in order to build healthy bone tissue and, you know, just keep those bones strong.
Yeah. And if you look at the next slide, and you know, I don't want to get in trouble with anybody, but look at this. The National Osteoporosis Foundation received funding from Kellogg's, the dairy farmers, and Basel Worldwide for the marketing agency responsible for the milk mustache and ads. So again, you got to be careful when you look at, I mean, we all know back in the days, everybody was on the commercial with milk does a body good and all that stuff, and that's where it's coming from. It has nothing to do with the benefits of calcium that you get the milk, rather than making you drink it because it's just an ad. Okay, so again, you can't get calcium. I mean, there's so many other sources that you can get calcium, like you just mentioned. Milk is really something that we shouldn't even drink as human beings, but we're being forced to because we're being lied to as far as the benefits of it.
Yeah, and that's also one of those things where, you know, on top of, you know, milk being really deceptive, it also creates a lot of other secondary conditions in people too. So a lot of people who have, you know, dairy, not only will they have, or not only do a significant amount of people are just, you know, intolerant with dairy, will they have digestive problems, but a lot of people will be very mucousy. They'll have to blow their nose all the time. They'll have allergies and all these other problems. And for some of these people, all you have to do is tell them, you know, stop drinking so much milk.
That's
and then
it.
a lot of those problems will
Stop
start to
drinking
go
the
away.
milk, period. I mean, if you really want the calcium, green leafy vegetables, and there's so many other things that can happen that you can get it from. Milk really is not a good thing. And one of the other myths that we talk about is, I mean, there's commercials back in the days about Tums for calcium. But let's break that thing, and because again, one of the things as far as Tums, it has to be in an acidic environment in order for it to actually absorb the calcium. But the main thing that Tums does is really to decrease your acidity level.
Yeah, it's one of those funny situations where you're putting a drug inside of you to decrease your acidity, but you market it as, oh, it's a great way to get calcium, even though we're turning off the most effective way for you to get that calcium into your bloodstream and therefore into your bones. Actually, when we look at the next slide, New England Journal of Medicine study concluded that after menopause, 40% of women cannot absorb calcium carbonate, which is a type found in Tums. Tums contain calcium carbonate. 40% of menopausal or postmenopausal women do not produce enough stomach acid to dissolve Tums and receive its calcium. The absorption rates were about 4%, thus it would require 50 Tums per day to reach the recommended daily allowance.
Wow. So again, you can drink your milk, you can take your Tums, but those are really not doing anything for you. As a matter of fact, they're actually counterproductive. So if you look at the next slide, it talks about why the misconception was created. But let's go and tell you some of the good things where you can actually get food that promotes bone density. And there's a list there. Those are things that are naturally found in nature that can better give you the calcium that you need to allow the body to actually heal itself and promote healing.
And the best thing about food, so this is beyond supplements, because a lot of times when you're buying calcium supplements, if you already have osteoporosis, you're already too late anyway. You're just making your pee really expensive, and that's just the truth of the matter. But when you're getting food and you're putting these right foods into your body before you have osteoporosis, then you're having a chance to not only get calcium, but food is loaded with calcium, magnesium, sulfates, vitamins, minerals, all those things you're getting into the food. And when you get all of those things as a bundle, then it makes it much easier for your body to use it and build the healthy bone more effectively.
And folks, we have about another 30 or 40 slides because we really did our research when it comes to the menopause and women health and osteoporosis and calcium deficient, but we wanted to get to the nitty-gritty of the things as far as how can we fix that. So if you're interested, please give us a call, go to Heal Yourself Radio, find our websites and call us in the office specifically, and we'll be more than happy to make all this presentation, all the slide, and all the information available to you. So now we really want to get into how do we fix these things? What are the things that we can do in our office? And just like you heard from Diane, what are the things that we do as far as the NUCA work to be able to get you back into proposition to release some of these things?
Definitely. But before we do that, let's take a quick commercial break. And when we come back, we'll talk about how do you correct these problems and how can we make life a little better for you as you go through some of these women's health issues. So definitely check out the website, www.nnradio.com. And if you want to get onto the phone lines, hit us up at 1-888-565-1470.
When was the last time you had your atlas checked? When your head and neck shift out of place, it can actually affect your whole body. Do you suffer from migraines, TMJ, dizziness, or chronic back and neck pain? If so, you may have an atlas problem, and you need a NUCA chiropractor. NUCA allows for a gentle and precise correction of your spine without any popping, twisting, or cracking associated with conventional manipulations. Call Keystone Chiropractic at 561-247-0044 and schedule a free consultation. Dr. Chung is one of approximately 300 doctors in the world trained in the NUCA protocol of spinal correction. Stop suffering. When your doctors can't determine the problem, you need to contact Keystone Chiropractic. We won't ask you to believe in chiropractic or commit to a lifetime of treatment. What we will do is show you what normal is, and we'll tell you how to get there again. We'll show you using precision technology that your spine has changed for the better, even after one correction. Then we'll show you the path for keeping it that way. If you are tired of constantly patching the problem and you're looking for a long-term solution that you can both feel and see for yourself, then a NUCA office is the right place for you. Once the foundation has been fixed, then we'll teach you how to keep it that way through customized recommendations designed for your spine so that the problem doesn't come back. What do you have to lose? Call today to schedule your complimentary consultation. If you call during the hour, we'll give you a $100 gift certificate to use towards your first visit. No questions asked. No commitments, just a conversation to see if we can help. 2 convenient locations in Boca Raton and West Palm Beach. Call Keystone Chiropractic today and end your days of suffering with chronic pain. Call us at 561-247-0044. Check out the website, healyourselfradio.com. That's healyourselfradio.com.
Are you searching for answers to your health problems? Are you looking for an alternative to harmful drugs and dangerous surgery? Have you tried everything else and figured this is just something you're going to have to live with for the rest of your life? At Upper Cervical Institute of Florida, we provide you with a safe, effective, and natural approach to restoring your health and regaining your life. Dr. Jean Pierre will find the cause instead of masking the symptoms. Dr. Jean Pierre utilizes the most specific techniques in detecting and correcting the vertebral subluxation. At Upper Cervical Institute of Florida, we pride ourselves in providing you with the highest standards of healthcare for you and your entire family. The procedure is gentle, effective, and affordable for everyone. Call now to schedule your free consultation. 561-409-3594. That's 561-409-6594. Or visit our website at www.uci-fl.com.
And we are back on the air. This is Dr. Jonathan Chung, and I'm with Dr. Gregory Jean-Pierre. And today we're talking about women's health on Heal Yourself Radio. So if you're checking out the show for the first time, welcome. Give us a call at 1-888-565-1470. And if you're just on the road and getting back home, then check us out on the internet, www.nnradio.com. So a lot of people, if you're a newer listener, you may not know that Dr. Jean-Pierre and I are actually doctors of chiropractic that focus on upper cervical correction, and we use a very, specialized protocol called NUCA in order to help a lot of our patients, because a lot of people associate chiropractic with the model where you go in and you get popped and cracked, and you leave feeling good for a while, and then you have this you have these misconceptions that you have to go in and you have to get cracked to feel good, and you get addicted to it, and you have to be seen for the rest of your life. And part of what our show is here to do is to help address some of those misconceptions and really to tell you that not all chiropractic is the same.
Right, and again, just you heard the commercials of several patients of ours that have called in the past on what we do, and today we're talking about menopause and thyroid condition, osteoporosis. But again, when you come in the office, that's not what our focus is. I'm not trying to figure out how to cure your menopause, which is, like we talked about, is something that naturally occurs in a woman's body. I'm not trying to cure osteoporosis. What I'm looking for is to look for any interference that's preventing your body to work at its optimal level. So, and what we do in the office is something specific called NUCA, and the NUCA correction is the most gentle form of chiropractic out there, but what it does is really get to the source of the problem, figuring out right at the brainstem level whether there's any pressure or interference, not allowing the proper communication to take place. And by doing that, the body really starts to heal itself as it was designed to.
Yeah, and the main thing that we're looking for is a problem called the atlas subluxation complex. And if you look at our slides here, you can see a couple of x-rays, and we take really precise x-rays to measure what's going on at the atlas. For people that don't know and haven't taken, graduate level anatomy classes, the atlas is the very top vertebra in your spine. It's actually what connects your head to your neck, so it literally holds your head up. And when there's a shift in that small vertebra at the top of the spine, it could create havoc on the nerves that are traveling through the neck, and it could also put stretching forces on the brainstem, and it could also interfere with blood flow going into the brain. And when you have all these things coming together, then it could create a serious problem with how the brain communicates with your body. Now, like we said, the brain is what controls every single structure and function in the body. And therefore, if it loses proper control, then that's when problems can start to come up.
Right. And again, I really want to get people to understand why it is that we do what we do. For me, I've told my story many times, and I'm going to repeat it again. The reason why I do this NUCA work is because my life was drastically changed by this. Unlike most people that just pick a career just for pick a career, this is something that I'm passionate about, because as a migraine sufferer for 20 years, I literally tried everything out there. I did all the CAT scan, MRI, X-rays, was given the drugs, try everything possible out there, but I still was having migraine. But fortunately enough, I was able to find a doctor in Missouri that did the NUCA work and took care of me. Really took all the X-rays, took his time to analyze the upper cervical vertebra, and it really found that my atlas was rotated by 1/4 of a degree on the right side. Very minimal shift that was putting pressure on my brainstem and not allowing my body to work properly. So the reason why I'm even on the radio today, the reason why I'm here talking to you, is because I feel like everybody should hear about this. Everybody should know that there's something greater out there that's able to allow your body to work properly and not suffer for as long as I have. Because I really suffered for 20 years where if somebody had came along, or if there was a radio show like this that my parents were able to hear and was able to find a NUCA doctor to analyze and see what was going on with me, I wouldn't suffer for 20 years. But again, if I didn't suffer, I wouldn't be here today. So I strongly believe that everything happens for a reason. So if you're here listening to us, it's a reason why you just so happen to tune into this channel, or somebody told you about this. Make a decision to do something about it and come see us. And again, what we're offering is a $100 gift card. It's just a conversation. You're not signing up for long care. You're not signing up for anything. Just come in, have a talk, and see if there's something that we can do to help.
Definitely. And, my story isn't quite as dramatic as Dr. Greg's here, but the truth of the matter is I always knew that I wanted to get involved in healthcare, and I wanted to do the most effective thing with my abilities in order to really help people to live the life that they were meant to live. And when I see people, and I see people that they're struggling with various issues in their health, then it makes me want to go do something for them in order to make their lives better, or the way that it was supposed to be. And we see so many patients ranging from things like Parkinson's disease, headaches, chronic pain issues, and a lot of it is the fact that they've gone from doctor to doctor without any real reasoning for what the cause of their problem or condition is. And if we could pinpoint that cause to a shift in the top vertebra in the neck, which is so common in many people, and we could fix that problem, that gives us a responsibility to tell people, that this problem can exist, and that you can get better if you get this problem corrected.
Yeah. And in both our offices, the kind of people that we see in the office are people that have tried everything. Just like myself, you've gone to different places and tried everything else, and you've literally been told this is something that you're going to have to live with and put up with for the rest of your life. You try the medication, you try everything else. So those are the kind of patients that we see in our office, and we are able to help them. So my ideal patient really is somebody that's really looking for perfect health. And just like when we talk about health, is a state of your body working at 100%, but not merely the absence of symptoms. Yeah, we take care of people with pain, they take care of people with symptoms, but just like I talked about when my children were born, I adjusted them not because they had back pain or neck pain or headache, but because I wanted their body to function at the optimal level, for the brain to be able to communicate 100% with the rest of the body, because that's the true meaning of health. So if you're out there suffering, yes, we want to see you, but there's a lot of people out there that just want to experience life and just want to be able to breathe better, see better, and experience life 100%. Those are the people that we want to see in our office as well, to make sure that you maintain that highest quality of life.
And we also want to address a lot of the things that really separate what we do from what everyone else does. And the truth of the matter is, when people come into our office, they have this expectation that they're going to come in, get a pop in their neck, and then they're going to feel a little better. And we believe that chiropractic should have a greater level of detail and science to that. And what we do is we actually measure where you are right now, because there's normals and abnormals for how your spine should be positioned. And we set benchmarks for every single one of our patients. So if we could see that we're going to get you 70% improved in your spine, then that's what we're going to go for. And we're going to show you on your x-rays exactly how much we've gotten and what that means for your overall health. And the other aspect is, we have a very gentle protocol where there's no popping, there's no twisting, there's no cracking, just a very light, gentle tapping force against the neck. and repositioning the neck into a corrected place. So that's why we use different terminology from most people. We don't call what we do a manipulation because that's just haphazardly moving things. You know, and it's very different from a traditional chiropractic adjustment. We call these things corrections because we expect to see a change, not only how you're feeling, but in the physical structure of your body.
Right, and that's one of the things that got me right away as a patient, because the guy took the x-rays, he did the adjustment, which I felt nothing, and then he took another set of x-rays, and right away, even though I knew nothing about NUCCA, I knew nothing about the adjustment, I felt nothing about the adjustment, but I was able to look at the x-rays before and look at the x-rays after and saw a change. I didn't feel it, but I saw a change on x-ray that let me know, okay, maybe he was doing something. You know, and so everything that we do is scientifically based. It's not, you know, you come in, your back is hurting, you pop you and you feel good and you leave. You and I will be able to quantitatively see what's going on and monitor your progress throughout the entire process.
And that's the biggest thing that we want, is that, you know, we don't want you coming in thinking that whatever is going to happen to you is just going to be placebo, because, you know, you could go and see anyone for a placebo effect. What we want to do is create a lasting change in your body so that your body will be able to heal itself throughout its life.
Right.
And what I've always told my patients is my goal here isn't to create, you know, a group of people that are dependent on chiropractic in order to live happy, healthy lives. My goal is to create health independence so that your body is flowing and functioning at 100%. And yeah, will you get checked every so often in order to keep everything in good shape? For sure. But it doesn't mean that you need to come in and get popped every time just to make sure that you live a life free of pain.
That's a great point, because a lot of time people are afraid that once you go to a chiropractor, you have to go for the rest of your life, which is not the case. And again, I don't want to do me understand, you definitely need a correction. You need to make sure your body's functioning properly. Case in point, you know, if you brush your teeth today, why are you going to brush your teeth tomorrow? Why are you going to brush your teeth the next day and the next week? Because you want to maintain that, because if you don't, your teeth going to fall. But guess what? If you don't maintain your spine and your spine goes out of alignment and it falls, you can't replace that. If you doubt me, ask Christopher Reeves that had an accident at the C1 vertebra. So yes, there's maintenance, but we're not going to see 3 times a week for the rest of your life. I've been getting adjusted personally since 2004, and I'm able to hold my correction for 6 months at a time. So again, just like you said, it's not about getting corrected and getting adjusted and become dependent on us, but it's actually teaching your body how to be able to hold a correction and how to live a healthy, natural, and pain-free and lifestyle.
Yeah, that's absolutely right. And every week on Heal Yourself Radio, you know, we'll be addressing these topics and bringing you the best information that we can in order so that you could use this knowledge to pass it on to others and to help yourself live a better, healthy life. So, you know, we've just about run out of time, so I'll go ahead and, you know, speak for Dr. Greg Jean-Pierre. You know, it's been a great show. Hope you got something out of this Women's Health episode. And if you want to catch some of our previous episodes, tune in to healyourselfradio.com. Check out our bios and check out our social media and get some more information about us. Otherwise, we'll see you next Thursday at 5 o'clock.
5 o'clock. And folks, I'm going to be doing an event this week at the Elks Lodge in Pompano. So for those of you that want to ask me any questions or whatsoever, I'll be there from 10 to 4. And I'm also going to do a quick screening just to kind of see how your body's working, and you know, you can get an idea what's going on.
That's it for me. Have a great one, and we'll see you next week.
Join Dr. Jonathan Chung and Dr. Greg Jean-Pierre each week on the Heal Yourself radio show every Thursday at 5 p.m. Listen each week as they interview leading health experts to provide you with comprehensive and natural solutions to make your body work at its best and solve chronic health problems. Right here on 1470 AM, the Health and Wealth Network. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of the station, its staff, management, or sponsors.